Welcome to Speak Out. I'm Sandy Galef, a member of the New York State Assembly, representing parts of Northern Westchester and parts of Putnam County. And today we're going to have a focus on substance abuse. And I think we're all so aware of the problems that are occurring both in Westchester and in Putnam counties and throughout our country, actually, with so many people that are involved in substance abuse and having major problems in their life and the life of their families. So we're going to be talking about it, what we should be looking for, how we get some help, and we're going to really discuss the issue and where we can go from here. So I have three wonderful guests with me. First, I'd like to introduce Ellen Morehouse, who is Executive Director of Student Assistance Services Corporation. Welcome, Ellen.
I'm happy to be here.
And Susan Simone, who's a parent of a youth who unfortunately you lost because of an overdose.
Yes, Sandy. I'm also the founder of Drug Crisis in Our Backyard.
Oh, okay. And
Yeah.
you obviously, that was...
I started that after my son
right.
passed away May 29th, 2012, just 2 years ago.
And how old was he?
He was 29.
29. Okay. And so you formed a group that's trying to help other people.
Yes, with a couple of other parents, the Christiansons, that also lost their son, just weeks after we lost ours.
And also Doreen Lockwood, who is the program director for the Putnam Family and Community Services. Welcome, Doreen.
Thank you, Sandy.
Is this, Doreen or Ellen, is this something, I mean, Susan has had such a terrible tragedy in her life. Have other parents done this kind of thing and gone forward and tried to help or get assistance some other way? What do parents do in that situation?
Well, there's really a wide variety of reaction, as Susan can tell you. Some parents are ashamed and don't want to talk about it and don't even acknowledge that it was an overdose. You know, they say something else happened, respiratory failure or something. There are other parents like Susan who want to get the message out and try to provide support for parents and information for parents that are going through these kinds of situations. So there's really a wide variation of parents' reactions.
I think that Susan and Stephen and Carol and Lou, who founded Drug Crisis in Our Backyard, have taken very courageous and brave steps in the work that they've been doing the past 2 years. In Putnam County alone, since 2010, we've lost 54 people due to overdoses. That's a staggering amount. I've worked in the business for 28 years. I know Ellen for a very long time, worked in Westchester for 10. The first 10 years of my career, I knew 2 clients who died. Now I have lost count of the young men and women and older folks who've lost their lives due to overdoses. So their work is very important. We're trying to reduce stigma, educate people about the signs and symptoms and all of the resources available to get help.
Susan, was your son, were there a group of people that he connected with that have also lost their lives or certainly been involved in substance abuse?
Oh, this is my son, Sandy. This is my son, Justin. And Justin started using marijuana when he was 16. And many of the parents that we meet with, parents that are really still dealing with it. I deal mostly with people that are still dealing with it. Their children have started with marijuana, and then they've progressed usually to pills. And he got addicted to pills when he was 23. He started using pills. And he did Oxycontin and opiate pills for about 2 years. And then he got addicted to heroin. And from about 25 to 29, he tried desperately to get off heroin. And that seems to be the pattern. They start with something simple like marijuana, alcohol, move on to pills, and after the pills become not good enough or too expensive, they start taking heroin. And once they get on the heroin, most of them want to get off because it's so deadly. And they realize it. And they're doing nothing but running after heroin all day and trying to get the money for it. And so that's the experience that we had with Justin. We dealt with his addiction for 10 years.
And when do
Can I
you
just
start?
say
Yes.
that, Susan's experience is one of the 3 common patterns of youth heroin and prescription drug use, and it's probably the most prevalent. But I think it's important to know that there are also young people who have never smoked marijuana, never had alcohol even, but they're prescribed prescription painkillers for a disease or for an injury or even for a tooth extraction. And they become physically addicted to the painkillers because the doctor or the dentist never discusses how to taper down or how long to take them. And then when they can no longer get the painkillers, then they turn to heroin. And then the third group of young people are the young people who've been seriously abused, either physically, sexually, or both, and want to use an opiate just to block out what's going on, block out the pain, feel numb. So there are 3 really different patterns to heroin use. The one that Susan explained that her son had is really the most common.
What about I've heard so much about the common prescriptions that people might have in your medicine cabinet that, just sitting there and so on. Is that something that also
That
becomes
is
a problem?
what helped this problem become so prevalent, the availability of prescription drugs. As you know, if you go to a doctor or you're in a hospital, it says, what's your pain level? And we want to certainly keep people with serious medical conditions out of pain, but with the accessibility of prescription drugs, most young people that come to our prevention and treatment programs will say that they got the prescription medication from their own family member's medicine cabinet or that of a friend. That's why we strongly encourage people to have inventory of their medication, to lock their medication, to appropriately dispose of their medication. I believe in Westchester and Putnam County and nationally, we have initiatives called medication take-back days so that folks can learn to properly get rid of medications because people steal them and then they share them and they sell them, and that's how this all began. I'd also like to reiterate what Ellen said. 15 years ago when I came to work in Putnam, 3% of the population used opiates. Right now it's over 25%, but the other 75% of folks use alcohol, marijuana, cocaine, and assorted other drugs. And too often we hear parents say, well, it's only marijuana, or it's not a hard drug. Well, the path from illegal substances can lead to heroin use, as Susan illustrated, and that's why we're out talking to people, and that's why shows like this are so very important. And there are many young people who, this is a recent trend, they don't even start out with alcohol and marijuana. They go straight to the pills because they are available. And that's
Let me
very
just say,
scary.
most of returning prescriptions, most of our police forces in communities have the take back. So if anybody wants to get rid of prescription drugs that they have around, they should just call their local police and see if they have one. But there might be some other places too where they can take that.
Half of the communities in Westchester County have actual drop boxes, so they don't have to wait for National Drug Take-Back Day. And there's no reason why someone from Peekskill can't drop off their drugs in Ardsley, or someone from Yorktown drop their drugs off in Ossining.
Right.
So we really want people to dispose of their unused drugs as quickly as possible.
So what about the age group? Are we talking about an age group? Is it your son, you said, started in high school at age 16?
With marijuana.
Right.
He really didn't start with heavier drugs until he was in his early 20s, but I think that might be dropping down. I think Doreen would have more statistics on age groups.
As I said earlier, 15 years ago, my average client was a white middle-class male, about 39, 40, who had DWI offenses or domestic violence offenses. Today, the majority of our clients are between the ages of 18 and their mid-20s. A large percentage of our clients. Now, those are the ones that are, admitted into treatment. Prescription drug abuse does not discriminate. You can see it in any age group. That is the trend right now that we see in treatment. But the elderly are impacted by prescription drug use. They have different medical problems. They have anxiety and depression. Sometimes as they get older, they have access to medications because of injuries or physical problems. Women in their 40s are also at high risk as well. So people need to be really really cognizant of the medications that they take. And we need our healthcare providers to really understand substance abuse and some substance abuse prevention, and to screen for substance abuse issues at all levels of healthcare. Nurses, doctors, dentists, everyone needs to be educated about substance use disorders and how to identify them. It's vital in our society because people are dying.
One of the issues that we had to deal with Albany, and I hope we're successful, to try to track where people are getting medications and if they're double dipping or getting too much, and whether the physicians are sending off a copy of the prescriptions. I don't know whether it's all working well. I don't know whether you've seen any of that. I mean, we're trying, because I think I've heard that people like to shop around, get to another doctor, get to another place, get another set of pills and that kind of thing.
Well, there's some anecdotal reports that part of the reason for the increase in heroin use is because it is becoming harder to get prescription pills because of the state's I-STOP legislation.
Right. So we do one good thing that causes another problem.
I just want to add the Westchester perspective. We had a very disturbing trend from 2011 to 2013. There was a 69% increase in the number of young people who came in for treatment because they were addicted to an opioid. So that's either a prescription painkiller or it's heroin. 69% increase.
That is huge.
In 2
That
years.
is huge.
And those
That
are
is huge.
12 to 21-year-olds.
Yes.
And how do we? That's terrible. I mean, that direction. How do we get it to stop? Where do we get it to stop?
Can I say something about the I-STOP law? Because the I-STOP law might be getting some bad press now, because what opponents of it are saying is that it's leading people to heroin. And I am strongly in favor of the I-STOP law. I know that
I am too.
Me too.
the I-STOP law, what they were talking about it when we first started our forums, and I never thought it was going to happen, I'll be honest with you, but it did happen. And so you're going to have a period of time where people that are addicted are going to go to heroin because they're addicted to opiates. But you have this very young group of kids that now are not going to get their hands on these pills anymore because they're not going to be on the street, and they're not going to pick up a needle and start shooting heroin if they are not already taking an opiate. The first opiate they take is not going to be heroin. So I think it really is the first step towards prevention of this this epidemic, starting to shut it down. So I really think that's one of the ways that we're going to be able to get our hands around this problem.
I agree. And working in a behavioral health clinic where we treat both mental health and substance abuse issues, our doctors go on the I-STOP program, and I hear our doctors talking about it, and it's very helpful because it stops doctor shopping up front. It helps doctors know if someone has a substance abuse problem, early identification, referral. It's vital. It's vital. And people, I think the misconception is a lot of young people thought that taking pills were okay because pills were from a doctor or a pharmaceutical company. You know, buying heroin on the street still is not looked at as okay. There's a certain stigma attached to that drug. Sadly, because as Ellen had said earlier, and Susan, then people are afraid and ashamed of seeking treatment, and we're trying to reduce the stigma about substance abuse, substance use disorders, so that people know that it's an illness, just like having heart disease or cancer or diabetes, and there's a prescription that you could follow, and there's treatments available. So we wouldn't be ashamed to say or someone in our family has any other illness. We want to be able to not be ashamed to say that someone in our family has a substance use disorder, an addiction, and needs to get the proper help.
How do we, what you're a parent, so hard to be a parent, and especially with teenagers, and as they go on. But what do you start to recognize? What are the what kind of things are you seeing in your children that might give you a clue that something is going on? I mean, they're growing, they're maturing, their hormones. I mean, there's so many things happening with kids. I mean, what are some of the things you look for as a parent?
you know, it's so hard because there are so many symptoms of substance use that mimic symptoms of psychiatric problems or even social issues that come up with peers. But I think the most important thing is to notice change. Change in behavior, change in friends, change in grades, change in the activities that your son or daughter used to be interested in. So if you have a son who's athletic and was always on a sports team and then just drops off, that's something to notice. But also change in weight, change in sleeping, change in appetite. So when you see changes, parents should always try to investigate what is the reason for the change. Also, many young people now are very smart about how to mask substance use, especially prescription drug use. And one of the things that they're doing is they might think that their parent isn't opposed to them occasionally having a beer or occasionally smoking marijuana. So a young person may go out on a Saturday night, take prescription pills, and feel, you know, very, very, you know, kind of woozy, and maybe their coordination isn't great. But before they walk in the house, they might take a sip of beer. So when they walk in and mom says, "What's wrong with you?" "Oh, Mom, I had a little too much to drink tonight." And Mom might think, "Oh, it's not a big deal. You know, he just had some beer." When in fact, he might be taking prescription drugs also.
Boy, that's hard to get to the basic fact on that kind of thing.
And there's some more blatant things as well. If you start to find drug paraphernalia in your house and actual pills in your house or rolling papers or marijuana, you know, in the old "it's not mine, it's a friend" is an old story that parents should not believe. So it's really important for parents to learn about the signs and symptoms and learn about the different drug trends and different kinds of paraphernalia that are out there, like, you know, cut off straws, you know, or the many different things, aluminum foil, cans of soda that are broken and have holes in them. Things that you know, you might not really think could be a symptom of something might be. So it's really
Where
important.
do you find out that kind of information?
Google.
Google.
Well, we also have our forums talk about
Right.
these kinds of things. Events that we've done together with Doreen, we talk about the things the parents will find, because that's who we cater to parents. Our events are really for the parents from the communities to come in and listen. And we've had some state troopers in with all the paraphernalia and going through each thing and what to look for in their kid's room. If they see a lot of small rubber bands around, that's a sign that something is wrong. Or
What does one use with small rubber bands?
well, that's what the drugs come wrapped in.
Oh, okay.
And we used to find Band-Aids. That's how I knew we're back at it again. We'd find a lot of Band-Aids and Q-tips. And if your spoons start disappearing, then you know something's up, because they use the spoons to burn the heroin, which then they then shoot.
And then those spoons don't go back into your...
And then,
right.
you know, we were like, we had no spoons left. I was like, where are the spoons? And so that's a big sign. So Google is one, but also
All of our websites.
all the websites.
All of our website information will be up. Drugfree.org, Under the Influence, are great websites for parents to learn about signs and symptoms, as well as our own agency ones. But all of the information is out there, and I think it's important that we realize that all young people and all people are at risk for substance use disorders. This does not discriminate based on where you live, how much money you
No,
make,
it certainly doesn't.
what your
So
religion is, or your
basically what you're
ethnicity.
saying is you have to learn about it, even if it may never happen in your family. You really have to do prevention, and you should go up on those websites, get information about what to look for so that you're prepared. I mean,
Correct.
it sounds
Right.
like that's the thing to do.
And also, parents need to explain why they don't want their young people to drink or use other drugs. Not to say it's illegal, or not to say, you know, it's bad for you or it's going to hurt you, but they really need to go into the detail and explain. And they can't just do a blanket, drugs are bad. So just for example, with prescription drugs, they need to explain the pill that might be fine for your 90-pound grandmother who's dying of cancer could kill you, my 200-pound football playing son, because my son may not have built up tolerance, whereas the grandmother has. So basic information. And the most important thing for parents to say is that they want their child to grow up to be healthy, not just physically healthy, but to develop the social and emotional coping skills to deal with all the stress that they're going to face. And if they face those with chemicals as a kid, how are they going to know how to deal with that as an adult?
So do parents have to be a little bit of a snoop in rooms?
Yes.
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 Yeah. Okay,
Yes.
good. Okay, I mean, that comes up in a lot of
Well,
different
would a
ways. but
parent ever
yes.
say, you don't have to show me your report card, it's private?
Right.
Right?
Does anything happen on the computer at all in this area, or is that?
You can
That
get
you have to look
anything you
for.
want on the computer. That contributed as well, I think, to the opiate crisis, that people can go on the computer without a prescription and get medication, benzodiazepines, opioids, which are controlled substances, and DXM, which is dextromethorphan, which is a very highly addictive substance that's in cough medicines. They can buy syrups of it. So for some young people, they have and people of all ages, they've been able to get medications from other countries on the internet.
Does that get sent to the house, or are they
Yes.
clever again, or they get home before their parents get home
Yep.
from work, or?
They're
all those
very
things?
manipulative. That is one thing about people that use drugs. They're resourceful and manipulative. One time when my son was on lockdown in our house, he had drugs being delivered to our house in our mailbox, and we didn't know it. So the dealers will bring them anywhere, really. It's house to, just make the call, and it comes right to your house.
Yes, you might be surprised by that, but in Putnam County, and I'm sure in Westchester also, there is delivery service.
So it isn't as though you have to go out on the street and find, because I was going to ask, are there people all around our communities that are out there selling?
Yes.
Yes.
Yes. To that too.
Yes.
So it's computers, it's sales.
Yes, I'm on the Putnam County Treatment Court team, and the majority of the folks that are in that, participants in that program, are in there related to drug possession or drug sales, and that is a treatment alternative to incarceration. So just like in the days of the crack epidemic, they would arrest one dealer, another dealer would come.
Right.
Dealers come in many different forms. Just like the face of addiction has changed, the face of drug dealers has changed. There are doctors who take money for drugs. There are kids that could be our friend, our neighbor, children that we've known their whole lives who are selling drugs to get money or to support their own
there
habit.
are some instances of teachers
Correct.
that have been suggested that we're doing that. so-
Sometimes, though, it's as simple as someone saying to their friend who might be on a stimulant for ADD, attention deficit disorder, and the friend might say, Sandy, I have sports and I have a test tomorrow and I really have to study. Could I just take one of your pills so I could stay up late tonight? That sounds innocent enough.
Right.
And I might give you one of my ADD pills. Am I a drug dealer? In other words, no money's being
Well,
exchanged,
right.
but technically
But
that's
technically you
illegal.
are, right.
But that's how it could start, and then that really helped. So the next time you come to my house, you use my bathroom, and my pills are right in the medicine cabinet, and you take some
Right.
more.
How do you find out which kind of service you have somebody in your home? It could be your grandchildren, it could be anybody in your home that needs some help. So how do you find out where you go for that kind of help? What kind of services are around? Is it staying home and getting help through the family and other resources, or is it going into somewhat of a group home for assistance? What does one do?
Well, there's several options. One is there's a state helpline that anyone can call, and it's 24/7, and you can call that number, which I know is going to be on the screen, and people can describe the situation, and they can find out what kind of help the young person or the adult should get. Should it be outpatient? Should it be inpatient? Should it be detoxification? Also, the United Way of Putnam Westchester also has a helpline, the 211 service.
Right.
People can call that and get information. They can also call any of the treatment agencies in Westchester or Putnam County. People always cross-refer. And when in doubt, call your doctor or your insurance company.
We do have people calling us also. Our website is Drug Crisis in Our Backyard, and they send us emails asking for resources, and we have a list of resources who are there on our resource list, and so they'll call Doreen, and then Doreen will refer them out to people. But the one thing that people should not do is be quiet about it. They need to move on it right away. It's important that they understand there's a sense of urgency and that it's not going to go away unless it's managed.
It's interesting because if you find out you have cancer, I think you get onto it right away. But you're saying that with this, you might think, well, it may go away, it's passing or whatever.
That's what you hope. It's
Right.
passing, and we thought that for years and years. And I know that it's very difficult for parents to accept the fact that their child is having a problem with drugs. But the purpose of our group is to bring awareness that this is out there.
When you said you go out to different places,
Yes.
to provide education and so
Yeah.
on for people. Do you feel that other parents come up to you because you are parents and that you have a greater understanding, or do they go to everybody to kind of
No, I think
talk
that
about it?
that parents come to us because we lost our child, and they feel compassion for us. So they feel that they could share their story with us because we've lost our child, and I think that we come from a different perspective than professionals because of that reason. It's a different experience.
And I think they identify with you, Susan, or any parent, as a fellow parent. And I'm a parent as well, and I think that helps me in my professional life as well. But I always have gotten calls from parents, but more so since Drug Crisis in Our Backyard has been established in our community and doing community forums. I talk to sometimes 5 parents a day. So again, we've broken the silence, and I always say to Susan and her group that, they're giving a voice to those who don't have a voice, not just their children and all the young people and older people have passed, but to the parents who are afraid to speak out, or the grandparents, or the friends, or the relatives. And back to your question about who to ask for help, families have a lot of resources, and I think they need to look sometimes at their natural resources as well, because a lot of families have someone in recovery in their family. So sometimes it's, or a friend or a neighbor. So sometimes it's also important to see, is there someone that the person who has a problem looks up to, someone in the family or a friend or neighbor that might be willing to talk to them. Sometimes members of our religious groups or spiritual groups are persons in recovery. There are many pathways to recovery. There are treatment centers, as Ellen had spoken and Susan had spoken about, but there are many pathways to recovery. Different things work for different people, so you really want to look at your own personal resources, your family resources, your neighborhood resources, because we really believe in whatever works for a person, let's find it for them and let's help them make it work. There is a barrier, though, that I'd like to bring up, which is insurance. There are parity laws, as you know, that state that behavioral health, which are mental health and substance abuse issues, are supposed to be treated as medical conditions like diabetes, heart disease, high blood pressure, and such. However, that doesn't really happen. I don't know anyone who's told that you have to fail outpatient treatment before you can go inpatient if you have any of those medical illnesses. But if you have a substance use disorder and sometimes even a mental health issue, we're told that. And that is very frustrating. And there's a lot of bills on the table in the Senate right now. There's a big rally called the Fed Up Rally in September to march on Washington about this issue. So folks that have substance use disorders can get equal and fair treatment, the same as someone with other illnesses can get.
We're at the end, and I want to thank you, Ellen and Doreen, but maybe, Susan, do you have one last thought you'd like to present to people here?
I would say that if anyone in your family is struggling with this disease, to come out on it. It's not something to be embarrassed about. There should be no stigma attached to this. This is a disease like any other.
Right. Thank you all very, very much.
Thank
And, if you have any issues, anybody who's watched the program, you have anything going on in your family, with your loved ones, please contact any of my guests or contact me in my office at 914-941-1111. Together, we can, as a community, rid ourselves of this major substance abuse problem that we have. So thank you very much for watching. Have a good evening.